So what about pregnancy? What about fertility? This is kind of a good news slide and no news slide. So in terms of fertility, I don't have a study that says, if I give 1,000 women trying to get pregnant a vaccine, that they'll get pregnant as the same rate as 1,000 women trying to get pregnant who don't take the vaccine. That study has not been done. We don't have that information. What we do know about fertility is that the COVID-19 virus doesn't just attack lung cells and your nose and throat, and we know it attacks brain cells, and we know it attacks gastrointestinal tract cells, but it also attacks the reproductive organs of men and women. And we know that harm occurs because of that attack. So there are people who have active COVID virus infection that as a consequence may have fertility problems to follow because of the immune attack that took place, or because of the virus attack that took place by the COVID virus infection on all the tissues of our body. That's the problem with COVID, is that it doesn't just attack the nose and throat and lungs, it attacks all of our tissues. And so we have already shown that fertility complications are likely in some folks who've had severe COVID infection because of the COVID's infection's attack on the male and the female reproductive tract. Now, on the other side of that, we do have information that really speaks to pregnancy. We've had some head-to-head studies of women with vaccine versus pregnant women without vaccine, and we know that the outcomes of the pregnant woman who is vaccinated are better than the unvaccinated. The unvaccinated woman likely will suffer more severe disease, more likely to be admitted to the hospital, more likely to experience fetal loss or stillbirth, more likely to have severe complications of COVID than a pregnant woman with, who did receive the vaccine. So unvaccinated pregnant women do horribly, and that's not unlike influenza, chickenpox, you name it. Many viruses, because of the relative immune deficiency state that is pregnancy, are able to attain a much greater foothold and cause more harm than in non-pregnant women. So we know that pregnancy, fetal loss, and stillbirth is much higher in the unvaccinated woman who's pregnant than in the vaccinated. Next slide. Our friends at Bay State have made a nice infographic that helps women understand, the very specific points of vaccination versus unvaccination. If you look in the lower gray box on the left-hand side, you see that it says COVID is very dangerous. It's more dangerous in pregnancy. Pregnant patients are 5 times more likely to end up in the intensive care unit than non-pregnant. So you can see the risk is there clearly for pregnant women. Preterm birth, more common. Stillbirths, more common. Fetal loss, more common. These are the things that you have to know when you're taking a chance with delaying your vaccine until after the pregnancy. Your pregnancy is at risk, and you could harm yourself. Certainly, you could harm your unborn child. Next slide. And as I pointed out, we have on our employee portal many of these articles that describe the injury that occurs from COVID-19 infection to women and men of reproductive age. And it's one of those that it doesn't definitively state that fertility is unaffected by vaccine, but it does definitively state that if you get a COVID infection, you are likely to have potential impact on your reproductive organs due to damage from the COVID infection.